Well, words like pulmonary embolism can be very scary for patients and their families. The price for treatments can be sometimes just as scary. But one Utah doctor is gaining national attention for his efforts to ease those fears. Today, in our continuing partnership with Intermountain Medical Center, a real-life scare that may lead to some real changes around the world.
I live a pretty active lifestyle.
Danielle Carbajal just loves to keep moving.
3 to 4 times a week. I was working out with a personal trainer.
But one day, she had to stop right in her tracks.
I actually started having symptoms at the gym.
Symptoms with a lot of pain.
I couldn't catch my breath. I felt really lightheaded, and I felt like someone was stabbing me in the chest.
After a day of pain, Danielle decided to go see a doctor.
I was told to a coworker I'd be right back. I was just going to go talk to Dr. Woller for a second and get checked out, and I'd be back in 15-20 minutes, and that did not happen.
What did happen was a preliminary diagnosis of pulmonary embolism, or blood clots in her lungs. But to make sure, doctors needed to perform a CT pulmonary angiogram, or a CT scan. It's an extensive process that can be overwhelming for patients.
They injected me with, I guess, the dye, and that was really, really uncomfortable, and it was very, very scary.
Scary and quite expensive, between $4,000 and $5,000.
It was probably the worst experience I've ever had in my entire life.
And now her doctor, Dr. Scott Woller, the director of the thrombosis program at Intermountain Medical Center, hopes to keep other patients from having similar experiences.
What we're really interested in doing is safely refuting this diagnosis in the simplest way possible.
Dr. Waller's new research was just published in a national medical journal. He wants to use a simple blood test to rule out pulmonary embolisms in about 20% of patients. This would mean a lot fewer of those scary and costly CT scans without any added risk.
While the benefit is being able to rule out pulmonary embolism in a larger proportion of elderly patients, we need to be certain that doing so, we do not inadvertently say pulmonary embolism is absent when in fact it exists.
Danielle just hopes Dr. Waller's research works out and makes it a little bit easier for the people sitting in a waiting room wondering.
I think any sort of easier way to diagnose or to prevent or to predict would be a benefit to the patient.